Hello, Study Nurse IQ family. Welcome back to the channel. I'm Jenny, and today we are talking about a topic that is often overlooked but is absolutely vital for surgical patients: nutrition and surgery. It is a huge NCLEX topic because, as nurses, our role is to optimize patient recovery, and that starts with what they eat. The nutritional needs of a patient undergoing surgery are significantly increased because the body is working overtime to heal tissues. When a patient is malnourished, it can lead to terrible outcomes. Please stick with me to the end as we have NCLEX-style questions to test your knowledge on the material. The hidden crisis: malnutrition in the hospital. Before a patient even enters the operating room, we have a challenge. Did you know that over 38% of elderly patients in the hospital and over 50% of elderly patients in short-term rehab centers show signs of malnutrition? This is a huge number. When a patient goes into surgery with poor nutritional status, it sets them up for a cascade of poor outcomes. These include impaired wound healing. The body simply cannot build new tissue. Postoperative infection. The immune system is compromised. Decreased functioning of the cardiac, respiratory, and immune systems. Impaired gastrointestinal tract functioning. Ultimately, this leads to a longer length of stay and an increased mortality rate. We have to address nutrition to prevent this. The power players: protein, energy, vitamins, and minerals. To support tissue healing and fight infection, we need to focus on three key nutritional components. Protein. Protein is a superstar when it comes to surgical recovery. We need it because it prevents tissue breakdown postoperatively. It assures healthy bone density and maintains lean tissue and bone minerals. Most importantly, it provides the essential amino acids needed for tissue synthesis and wound repair. After surgery, the body enters a state called catabolism, which is the breakdown of complex molecules to release energy. When this catabolism exceeds the intake of protein, it can lead to or worsen malnutrition. The body loses protein due to stress, hemorrhage, infection, or edema. To repair that tissue, the body requires essential amino acids, which we must provide through the diet or through parenteral nutrition. To energy, or kilocalories. Energy is absolutely vital. We need sufficient kilocalories for tissue building, but also to protect our protein stores. This is called protein sparing. When we provide enough energy in the form of carbohydrates and fats, the body uses that for fuel and spares the valuable protein for its vital tissue function: healing. Adults require at least 130 grams of carbohydrate per day to spare protein. If a patient has had extensive surgery, major trauma, or sepsis, their energy demands skyrocket to between 20 and 40 kilocalories per kilogram per day. We must increase energy intake to meet those needs. 3. Vitamins and minerals. Finally, we need certain vitamins and minerals, specifically the B-complex vitamins and iron, to support the entire healing process. Specialized diets: dumping syndrome and burn patients. As nurses, we need to know the specific diets for patients with unique surgical needs. Post-gastrectomy dumping syndrome. If a patient has had a gastrectomy or surgery on their stomach, they can develop dumping syndrome. This is when concentrated food rapidly moves from the stomach into the small intestine, causing uncomfortable symptoms. To manage this, the patient's diet should include 4 key principles. Small, frequent meals throughout the day. No liquid with meals. Fluids should be consumed between meals. No milk, sugar, sweets, or desserts, as these concentrated simple sugars trigger the rapid dumping. A high protein content to support tissue repair and slow gastric emptying. Burn patients. Burn patients are a specific, severe example of needing intense nutritional support. A diet that is very high in protein and high in energy is essential to replace the extensive loss of tissue protein at the burn sites. Provide the essential amino acids needed for that extensive tissue healing. Counteract the negative nitrogen balance from a loss of lean body mass. Meet the added metabolic demands of the infection and fever that often accompany severe burns. As you can see, nutrition is truly the foundation of recovery. Now let's test your knowledge on the nutritional requirements of a surgical patient. Question 1. The nurse is reviewing the dietary needs of a patient who is 3 days postoperative following a large abdominal surgery. The nurse understands that which nutrient is essential for preventing tissue breakdown and supporting the synthesis of new tissue. A. Carbohydrates, B. Fats, C. Protein. The correct answer is C. Rationale. Protein is the key nutrient in the postoperative period because it supplies the essential amino acids needed for tissue synthesis and repair. While carbohydrates provide energy and iron is a necessary mineral, protein is directly responsible for building new tissue and preventing catabolism. Question 2. A nurse is providing discharge teaching to a patient post-gastrectomy regarding prevention of dumping syndrome. Which instruction should the nurse include in the patient's diet plan? A. Consume plenty of fluids with meals to aid digestion. B. Restrict carbohydrate intake to less than 130 grams per day. C. Avoid high-sugar foods and liquids during meals. D. Eat only 3 large meals a day to limit gastric stimulation. The correct answer is C. Rationale. Dumping syndrome is triggered by the rapid entry of concentrated simple sugars into the small intestine. Therefore, the patient must avoid high-sugar foods, sweets, milk, and liquids during meals. The goal is small, frequent meals with a high protein content and no liquids during the meal itself. Question 3. The nurse understands that sufficient energy provided in the form of carbohydrates and fats in the postoperative diet is important because it performs which vital function? A. It increases the patient's basal metabolic rate. B. It acts as the primary source for essential amino acids. C. It spares protein for its vital role in tissue repair. D. It helps to decrease the patient's need for iron and B-complex vitamins. The correct answer is C. Rationale. Providing adequate energy, especially at least 130 grams of carbohydrate per day, is crucial because it ensures the body has enough fuel. This process, known as protein sparing, prevents the body from breaking down protein stores for energy, thereby allowing the protein to be used for its vital function of tissue healing and synthesis. If this video was of value or added value to you, please head to our YouTube channel Study Nurse IQ and click subscribe. I'm Jenny, and I'll see you next time.